So a lot of people come in the office asking about dense breasts, and they wonder, first of all, what are dense breasts and how do we detect them? Well, some people think that because they do a self-exam and maybe they feel things on exam that they have dense breasts. But actually the only way to really detect a dense breast is by having a mammogram. When you have a mammogram looks at the breast tissue with x-rays, and they basically look to see how much glandular tissue you have versus how much fatty tissue. The more fatty tissue you have in your breast, the easier it is to detect things that are abnormal on a mammogram, and so the easier the job for the radiologist. Now, if you have dense breasts, then you have a lot of glandular tissue. Glandular tissue is the part of the breast that makes milk, delivers it to the nipple if you're having children. And what happens with dense glandular tissue is it looks white on a mammogram. Well, cancer can also look white, so dense glandular tissue makes it more difficult to detect cancer. In addition, patients who have dense breasts are at higher risk of having breast cancer. Now, we don't always know why that is. Sometimes it may be because of increased hormonal stimulation that increases the risk of breast cancer. But we know that not only are dense breasts more difficult to examine on a mammogram, but they also increase a woman's risk of developing breast cancer. So the question that people ask me, they come in all the time to the office and they say, how can I best detect cancer in my dense breasts? And I tell them, well, we have a combination of things. Every woman should have, once she's over the age of 40, should have a yearly mammogram. We never want to omit the mammogram even if you have dense breasts. In addition to your yearly mammogram, we have two additional techniques that we do recommend for women who have dense breasts. One is 3D tomosynthesis, and the other is ABIHM, which is a whole breast ultrasound. Used in combination with the yearly mammogram, these techniques should improve detection of cancer in dense breasts and lead to improved survival.